When a child develops diarrhea, these are the probable signs: passage of frequent, loose and watery stools, abdominal cramps or pain, fever, particularly if there is an infectious cause, bleeding, as bacteria and parasites often can produce bloody diarrhea in addition to inflammatory bowel disease. Mucus in the stools, nausea and vomiting may also be present in the case of infection. In 1990, a diarrhea program began in Kenya under the Ministry of Health. Subsequently, the use of oral rehydration salts among children under 5 years of age with diarrhea had a good uptake. Currently, though, despite its use in Kenya having prevented the death of 2 in every 10 children aged below 5 years from diarrhea, its uptake has declined.
Kenya has the lowest use of ORS in the region. As for zinc was introduced in 2005, so it's a relatively new intervention. And this is because it was seen to reduce the amount of diarrhea and the duration and the severity, especially the duration and the severity.
The challenges seems to be that health workers have failed to advise parents of children with diarrhea to use rehydrating salts, a serious lack of information or disinformation about how to treat diarrhea has seen children die from the otherwise preventable disease.
Information from the top, starting with this policy, what is expected to be done, to the health workers, what they are supposed to do when they meet a mother with a child who has diarrhea, to the mothers and the caregivers, what they should do when they have a child with diarrhea. So it's information, and then avail the ORS and zinc, because we have seen together they even give you better results.
Lack of safe and clean water also remains a challenge among mothers wishing to save their under 5 children from being part of the many death statistics.
Sometimes a mother may want to give, maybe she has no water. Now, who helps her get that water to maybe constitute that ORS? Because what is given by the health worker is the sachet of ORS the mother is supposed to constitute. She may not have the water, or she may not maybe have that information on how to do.
Some time ago we used to hear about water for everybody by the year 2000. 2010, down the line, we still don't have enough water. No single town in this country has enough water.
2 recent advances by the World Health Organization and UNICEF in managing diarrheal diseases have introduced newly formulated low osmolarity oral rehydration salts containing lower concentrations of glucose and salt. Success in using zinc supplementation to reduce severity and episodes of diarrhea have also been recorded.
ORS has been there. Like I said, zinc is new. The government has taken it up. They're starting to stock it. So as of this moment, maybe all the facilities don't have all the things they need. But as the demand comes, hopefully we are going to see that mothers know that they should give fluids. The question is, why don't they give fluids as they are supposed to give? That's what we need to find out, the answer to that.
Despite that, the current oral rehydration salts currently in the market need to be standardized in order not to confuse mothers who desire to receive them for free at any public health facility or buy them at a pharmacy.
A mother seated out there may go to Nakumatt and find sackets of ORS. They will not know whether it's normal or smaller ORS, what Dr. Murithi calls standard ORS, what was there before, or low or smaller ORS. I think we need to quickly standardize all the ORS sackets that is in the outlets so that the mothers don't get confused.
Scaling up these very simple interventions for prevention and treatment of dehydration with appropriate fluids, breastfeeding, continued feeding and selective use of antibiotics can also help reduce the duration and severity of diarrheal episodes.
Hand washing, and as I told you earlier, 44% of diarrheas can be prevented by hand washing.
Children below the age of 5 are treated for free in any public health facility for diarrhea, just like malaria. Zipporah Karani, KTN for Health Digest.